everybody, it's Octavia Martins, your Brazilian British gynecologist in London. Today I would like to talk to you about HPV virus, cervical cancer and fertility. Because HPV virus is very common infection that can cause abnormality in the cervix and lead to cervical cancer. Let me show you what area I'm talking about, this area here, okay? So, and sometimes if you delay having your smear test, you have symptoms like postcoital bleeding, pain after sex that you didn't have before, offensive discharge, and you don't look for help. When you come, you might already have the cancer. It's called cervical cancer. And in some cases, you will remove part of the cervix, okay? So you have to remove part of the cervix. This part here, you have to remove. And why it is important fertility treatment? Some women, they develop stenosis. What happens with the cervical canal? It closes down and sperm cannot swim inside, okay? So it's one of the consequences of having this part removed. Sometimes the cervix become too short, and then you have the fertility treatment, you can have a miscarriage, because when the baby becomes bigger and heavy, and the baby goes away, you have a miscarriage. So because of that, if you had any surgery in the cervix, had cervical cancer, and planning fertility treatment or planning coming for checkups, it's always good to have the cervix checked, have a up-to-date smear test, because the main cause of cervical cancer, sadly, is HPV virus. It now is increasing even older patients, because everybody's more active nowadays. There are those tablets that have for men, they can have intercourse longer age. So it is important to have those checkups and think about cervical pregnancy after cervical cancer, okay? Or after cervical surgery. It's Octavia Martins, your Brazilian British gynecologist in London. Bye.